And I believe yesterday we just completed our 30th dissertation defense that was successful. We're going to become a model for the university at that rate, I think. Dr. Kopko came to the college in 1986 after having worked for most of the previous 3 years in Bangladesh and Tokyo. And she is going to moderate this panel, which includes those who have been or are international students in the College of Nursing.
Thank you, Lynn, and thank you all for being with us on this joyous and informative day. I'm going to introduce our panel members. So starting at your most left, Joka Al-Harti earned her bachelor's here in 2007 and then returned to work in Oman as the deputy charge nurse in the operating theater and then as head of the ambulatory care department at Kula Hospital in Muscat. Prior to coming to Villanova the first time, she had a fellowship at Fujita Health University in Japan. She's here to earn her MSN in Healthcare Administration. Faith Ate works as a staff nurse at Lord's Specialty Medical Center in New Jersey and has obtained all of her higher education in the United States. She is in the nursing education track in our master's program. She volunteers with the Global Literacy Project, and she aspires to return someday to teach in Kenya. To my left and your right, I get that mixed up, Dr. Bingbing Chi earned her MSN in nursing education here at Villanova in 1994 under sponsorship by Project Hope. Upon her return to Beijing, she taught at Beijing Medical University until she was accepted for study, leading to her PhD at the University of Maryland, where her research entailed a randomized controlled trial of a program to prevent osteoporosis among Chinese immigrants. Dr. Chi joined the full-time faculty in the College of Nursing here at Villanova in 2007. Dr. Hilal Al-Rabi, number 27, I will always remember you by your number, completed his dissertation and defended it in March. He focused on diabetes self-management among Omani people with type 2 diabetes. Previously he earned his bachelor's and master's degrees here, and before he returned for doctoral study, he taught at the University of Nizwa in Oman. This summer he will return to the faculty at the University of Nizwa. And at my far left, Raja Jedalhak is a candidate for the PhD here, and she earned her master's in nursing education here in 2002. She was one of the first cohort of nurses to earn a BSN in Saudi Arabia, so I've always called her a pioneer. Prior to her return for doctoral study, she was the Ministry of Health Chief Nurse of the Jeddah region, one of 17 regions in Saudi Arabia, and she will return to the Ministry of Health when she completes her PhD very soon. And it was my great honor to have taught all of these panel members. So it's a pleasure to be here in this context. So I'm going to start the conversation by asking you, not necessarily holding the row, but asking you to each share how your professional journey brought you to Villanova.
Hello, everybody. Can you hear me well?
No.
First of all, thank you for this opportunity, and I'm very happy to be with you today. I was in 1999. I was here in the United States with my husband. He was here for job training. And at that time, I was working as the head of nursing education department in the maternity and children hospital in Jeddah. And I was supposed to stay here for like 2 years, so I was looking for completing of my studies. I searched the website. Villanova College of Nursing was one of 3 options that I was accepted in. But I chose Villanova because from the first minute I came to this college, I felt the family atmosphere and environment, which is exceptional in this university. So that's why I chose this university. At that time, when I was graduating from the master degree, it was the September 11 attacks, and I had a hard time with me and my family in the United States because of the misunderstanding of some of the people about the peaceful religion of Islam.
Okay. Who else would like to tackle this?
I came to this country in 2003. My very first school to go to was College of Staten Island, and I was prepared to go to med school, so I was a pre-med student. But the College of Staten Island was very expensive for my parents to pay the tuition fee, and I had to transition over to think, what other field could I do that would allow me to help people, and that was easily nursing for me. So I changed my major and I started my nursing career. And my friend who comes here for her master's in engineering told me, you have to come to Villanova, it's the best school ever. So that's how I ended up here.
Thank you.
I came to Villanova in 2000, and I joined the RN to BSN program in 2002. And I knew Villanova through one of the American professors at one of the nursing institutions in Oman. She gave me the email of Dean Fitzpatrick, and that email, was as if she has been knowing me for 4 years. She emailed me back immediately, and she explained the whole thing. You can go from your RN to your master. It was igniting and inspiring email. So I came here in 2001 with my family, and 2001 9/11 attack happened. I went back to Oman. I thought I can't continue anymore here, and it's becoming risky to stay here, and so many calls back home, come back. It's not becoming So I went back, but I thought of the first semester I spent here. It was inspiring, and I said I had to go back to Villanova. So I intended to come back, and came back in 2002 and finished my RN to BSN program in 2002. So that's basically in short about it.
Yeah, thank you.
Hello everyone, I'm honored to be here today, and I came here in 2006 for my BSN. And I remember the day when Dean Lewis, she interviewed me for the BSN. She was there in Oman. And today with the presentation of Dr. Naim, I know everything how it started. I remember my first time after 1 month, I was living in Devon, but after that I shifted to host family. I lived with them, and I remember the first time I took a train myself alone. I lost to go back where I live. But it was a beautiful loss, if I can tell you. I meet 2 friends in the train, and they're still near to me till now, and there was a blessing.
That's great. Ying, how did you come to Villanova?
How do I come to Villanova? It's a long story. But it seems like yesterday I was here. I actually graduated in 1989 with a bachelor's degree in China. I was one of the first nurses in China to receive the bachelor's degree in nursing, following a 20 years suspension of collegiate nursing education in that country. And after I graduated with a BSN I actually, a strong commitment to teaching and scholarship leads me to a faculty appointment at my alma mater in Beijing Medical University. Now they call it Peking University Medical Health Center, something like that. After that, at that time, actually, nursing education is not really at very higher level. So People-to-People Foundation, Project Hope, and Beijing Medical University, we have joint venture program. They are helping China to, the university level to build a better nursing education in bachelor's level. And also, they sponsored 2 faculty members from Beijing Medical University to come here to the United States. They actually visited several college universities, and they find very impressive. Villanova University have the best nursing education program, and also they are very impressed by the hospitality and the strong, like a family environment here. So they like it here very much, and Project Hope decided, and also my Beijing Medical University, the dean and the faculty, they decided to send me over here to study. So Dean Fitzpatrick graciously accepted me as one of the 2 international students. So Salam is the first one, I was the second one. And that's how I come to Villanova. The first time is Villanova actually chose me, but the second time, after I graduated with my PhD, I chose Villanova because Villanova's missions really fits my mission. I truly believe there is intrinsic connection between the mind and heart, and also the love and the truth. So I really feel comfortable here. In 1993, that was 20 years ago, that's when I came here. So I remembered I was sitting over there to celebrate the 40th anniversary of College of Nursing over here right in this room, just like 2 years ago, 2 days ago. It's a long journey, so yeah.
It's a great story.
All right, thank you.
So today's focus has been on global health, and I wondered if each of you could think about how your Villanova education has contributed to your evolving understanding of global health. Who wants to tackle that?
I'll go first. So, prior to today, or prior to maybe 3 years ago, I wasn't really thinking about global issues because you have to understand, I came here in 2003. I'm about to say my age now. I was only 20 years old when I came here, and such big global questions and issues had not formed in my mind. So by the time I came here, I was focused just to go to school, and though I knew about social determinants of health, like poverty, because I saw that in Kenya, I really had no questions about it. I just saw it, and I never really thought, how does it influence a country? How does it affect the globe as a whole? But as I continued to go to school, especially come to Villanova, I realized that there's so much to life than just me. There's so much out there globally. And I started thinking about looking at poverty back home and poverty here. Poverty is everywhere. And thinking about global issues, how it presents itself is the difference. Poverty here has a totally different aspect as compared to poverty back home. So being in Villanova and just listening to all the professors talk about international health makes me want to be a better nurse and just to give back to the community as a whole. I don't have to go to a different country to provide global health. I can still be here in America and see a different person from a different country and say, I see you, I understand where you're coming from, and I can help you.
That's great, thank you. Other thoughts?
Yeah, I think I will, I don't have detailed answer for this, but I will reiterate what Faith was talking about. I think I'm not coming from a poor country to have that perspective, but I think the type of education and experience you receive at this institution really open your eyes to open your eyes globally, thinking in different, making you thinking in a different perspective. I come from a system where it focused only on disease, and we are as if we are not connected to the other worlds. So yes, the type of education and experience you get within this institution really helps you to look into things with a different perspective, which is basically global health. So, yeah.
Yeah, definitely I will second that, echo that. I think myself is a great example of global health. I came here on a focus scholarship sent by People Foundation, the Project Hope. At that time, Villanova also offered some courses that focus on like a global health. I think at that time it's called international nursing. It's really studied here at Villanova with my master's. Really, actually, I would say changed my whole life. There's so many doors and for the opportunity for personal growth and also professional growth. At that time, I think Salam and me, we were the international students. We were the only international student at that time. And there is a NLN convention conference. So I think Dean Fitzpatrick and also other faculty members take the international students to the NLN conference. They want us to expose to other nursing perspective ideas. It's really studying here itself is like open up my mind. Help me to think nursing differently in a different perspective.
As you know, I'm from Saudi Arabia, and I have been to several countries in the Middle East and in Europe. In Saudi Arabia, we have the money, we have the resources, but I think we need the experiences of other countries. That's why I am here, and the government of Saudi Arabia is sending many scholarships to all over the world, and the United States is one of them. And as the first speaker said today, that we are not supposed to just copy what is present in the United States and use it in other countries. I think we can take some of the experiences of US or any other country and modify it to our culture and our health system over there. I do believe also that the contribution of nurses globally is important, and after I have seen other countries' experiences, I think the only solution, or not the only, which one of the important contributions from the nurses is to change the education, to shift the education according to the needs of the global world. Like what Dr. Naima said, we have to look at what's going on in the Middle East, the emergency cases, and specifically in our country, we have a lot of road traffic accidents. So it has to be related to what's going on in the globe, in the area where the health system is there. And other thing which I learned from global is nurses are always making difference. When I'm looking at the news nowadays in the Middle East and what's going on, nurses are always in the hospitals, and they are the people who are working with the wounds, with the patients, and they are making difference in whatever the situation is.
I'm going to come back in a moment to something you said, but Joko, would you like to reflect on global health and how your thoughts have changed?
Yeah, I mean, during my BSN, I never thought about global health, but when I came back here, I looked back in my clinical area as administrator, and I was head of ambulatory department, and I was looking for orthopedic clinic, and I used just to take around and do the normal work of every day. But when I came here for my master and I started reading some of the articles, I came about osteoporosis, one of my independent studies. I'm doing it. Back in Oman is really high, I mean, high rate of osteoporosis back home. I really would like to go and change something because the culture and other things, people there, we are coming from hot weather, the climate is very hot. People, they're so scared to expose to the sun because they feel like we'll go with the skin cancer or something, the type of clothes we are wearing. I would like to do something really to change this view about it.
Okay. I wanted to go back to the point that Raja, that you just made about not everything can transfer back. So I wonder how all of you, and Faith hasn't yet been back, but you will. So I wondered if all of you could reflect on how you determine what from your U.S. education works back home and what is not so helpful. How do you make that transition?
From my experience over here, when to be realistic, when I came during my master degree, in the first few months I was shocked really. It's completely different. The way the education system in Saudi Arabia is completely different than the system over here in the United States, and even in the schools because my kids were here in the schools. Nurses are, it's not only in the colleges, also in the schools in back home. It's just like spoon feeding. There is no class discussions. There is no relationship between students and the teachers or the professors. Usually the professor is up and the students are, there is no much communication. Whatever they say is right, and there's no discussion about it. So I really had a difficult time in the beginning. I was silent for like 2 or 3 months until I get to discuss in the class. So I think this is something which has to be considered in Saudi Arabia. Something else is that when I went in clinical areas with the nursing students, and that was also during my master degree, the nurse students have very much confidence when compared to the students over there back home. And I think this is a very important issue that has to be discussed over there because it influences the whole education process of nursing. So these are the changes which I really found between there and there.
When you went home, was this a problem that you had changed?
No. I have really my experience over here really changed even my personality, my professional personality, and I myself felt that, and the people around me felt it too. And within 3 years, I was, as I told you, I came here as the head of nursing education department in the maternity and children hospital. When I went there, within 3 years, I was promoted from being head of nursing education to the director of nursing in the MCH hospital, and after that, I was promoted to be the nursing director of the whole region, which I have like 5,000 nurses under me, and for the Jeddah city and the small 3 cities around Jeddah, 3 small cities. And I did a lot of changes during these 3 or 4 years before I come for my doctorate studies. At the end, we won the prize of the best nursing administration for the whole kingdom. So I felt that I did a lot of contribution to my country and to nursing after I came from Villanova. It did a lot of changes for me and for the place where I did work.
Thank you. Great. Okay. Who else would like to?
After I graduated here, I was energetic and enthusiastic about what I've learned. I think Villanova prepared me well with the ability and also the knowledge and also that what I need to make the changes. So I'm so eager to go back to China and to try what I've learned, new things. I did make some changes and also I received some challenges at that time. So when I went back, I was one of the 3 master's degree prepared nurses in the whole country in China. So at that time I was working, they promoted me too, and I was one of the supervisor for the first graduate program in Beijing Medical University, and also I became the program administrator at that time. Also play a role to try to influence the direction of quality of nursing education in China. And also I try to revise the curriculum and try to introduce new courses and learning experience for both graduate and undergraduate program. I'm happy to really make some changes because for the new courses that I offered, I would try to apply what I've learned here back to China to that situation. And also in clinical teaching, I was trying to make some changes at that time. But after 2 years, I kind of feel like what I've learned is not enough. And also after I graduate from Villanova, I feel like I'm empowered. I really have the power of trying to make a change of the whole world. I mean, I think like in China, there's everything can change. Nursing can be as good as in the United States or other countries. But reality is not like that. So one person cannot really make all the changes. So there's lots of challenges. I was trying to do as much as I can, and also I go around, travel all over the country as one of the consultants. I was invited by the American Nurses Association, Chinese Nurses Association, for the Nursing Higher Education Committee and the Research Committee to give talks and give presentations all over the country that like a new perspective about nursing care. I think that make the potential changes, for nursing education in China. That was 20 years ago. And now we have 8 like a nursing PhD program in China, and also have lots of masters prepared nurses there. So I'm happy that I can make something based on the foundation that has been built from Villanova. And at the same time, I feel like it's really not enough knowledge, not enough the things that I need to have. So I decided to come back in 1996 after 2 years that I work in China. And study for my PhD. At that time, I really actually fall in love with research. When I was a master's student at Villanova. So 2 years later, I come back and I truly believe nursing research will make a big difference. So besides the knowledge that we learned, nursing research can really speak up and make bigger changes rather than one person can make a smaller in nursing education. So that's what I feel. Mm-hmm.
Who wants wants to speak next?
Just to add on to what Dr. Bain said, she said that one person cannot make a big difference, but I do believe that one person can ignite change, can make another person want to do something different. So just to add on to what she said, that's all.
When you go back to Kenya, do you have thoughts when you go back, when you do go back to Kenya, do you have thoughts about what from your education you will readily be able to use and what might be difficult to use?
Right now I have something that I have in mind. Due to several calamities that have happened to Kenya, people acquire a certain kind of shyness, especially girls. So, and that's a learned behavior. So what I have in mind is to help a girl child, to help girls to unlearn the behavior of shyness, take it away, and put in confidence. If you have confidence, you can achieve a lot. It doesn't really have to be rowdy or anything. You just need to take the shyness away, be confident, and go for what you need. So that's what I have in mind. I can start now. That's an easy part to start. So I can do that now.
I think you will.
That's the confidence that I also learned that in China. I mean here, when I first come from China. The confidence really, you think you can really change everything, that you can make the change. So I'm like, at that time I was at Villanova, so it's like a seed that planted in my heart, and to really build up my confidence. And then I'm trying to like I'm planting seeds to other people. So be a good scholar, be a good teacher and researcher. Try to teach other students the same thing, so they can plant the seeds to other people's heart.
Yeah, I think it's well stated here. But the good thing that the first thing I arrived at Villanova, the message was, not everything we teach you here will be appropriate for your culture. So it's part of the message that was sent to us when we actually started at Villanova here. And I'm not sure if all of you knows that in Oman, we don't do clinical for obs and gynae. So I have never done obs and gynae during my nursing course. So that's one of the things, maybe an example how things that taught here or happened here would not be accepted back there. But again, well stated here, and a message was given by, don't want to again mess up his last name, but by Dr. Luis Hogo, that one thing I wanted to do, and I did before that, I want to get people together at the table and take different perspective. Because the change is difficult, especially in a culture where we live. People are not very receptive. People are not well educated to understand your perspective and listen to you. So this is maybe one of the things I wanted to work on when I go back home.
Thank you. Joko, what's your thought about what you can take back home and what might not go back home with you for your education?
I think there is things I will take with me home, but the class we took about politics and health policy, I don't think I will be stopping the health insurance here in USA. Although I know in back home we have free health care, and maybe it's alarming. We have to start thinking about it and think how we'll do in the future when we don't have all those oil or something. But here, really, I don't want to take other things about health insurance. Thank you.
That's a good thing to leave here. I'm interested to have you reflect on what it means to you to be a Villanova nurse.
Can I take that?
Sure.
It meant a lot to me, really. Not only for the knowledge we have here as we take our skills and other things. We learn a lot from Villanova, and especially with me because I was interact with other organizations in Villanova. It didn't build my personality only in the way of nurses, to be a nurse and other way. It's add a lot of things with me, and I think the message of Caritas Unitas, Veritas, it will go with me everywhere I will go.
Thanks.
Being a Villanova nurse, when I first came here as a graduate student, I met, I don't know if she can remember, it was Dr. Schlag that I met first, and I just walked into her office uninvited with my friend just to ask about the graduate program. And she was kind enough to give me her time and listen to me and tell me what the program is all about. Even before I was accepted into the College of Nursing, she had already seen me as a person and took time to hear out my ideas, my issues. So what I take from here is I will see another person as a human being and value their thoughts, ideas, and just to let them know that they matter.
That's great. That's really great.
Being a Villanova nurse, I'm really very proud to be graduated from Villanova. And I mean, before and now I'm as a student, a PhD student. I will tell you shortly about my experience when I started over here in my 2009 when I came back for my doctoral studies. I had several health issues related to my family when I came and I had to go back to Saudi Arabia. I will never forget the kindness and the great understanding of Dean Fitzpatrick at that time and the director of the PhD program, Dr. Nancy Hopko. I learned, it was a very difficult experience for me, but I learned a lot from the people over here, how they handled the problems of the students. They were very generous with me and they just postponed my studies for 1 more year, and I was inspired by the way they dealt with the problem which I had, and I came back in 2010. The experience which I had which I'm having in the PhD program is phenomenal. I am, in Saudi Arabia, the nursing research is still in its infancy phase, and I hope when I go back that I will be able to use the research methodology and open, like in the Ministry of Health in the nursing department, open a department for research and to start research in Saudi Arabia. So I think this can be a big contribution to our country, which I had learned from Villanova University. The other thing which is I'm working now with my dissertation, I'm doing patient satisfaction and its relationship to the level of nurses, level of education of nursing. And I had the experience to be with my husband over here in the hospital when he was hospitalized, and it was funny that my son was telling me, Mom, please make a list of the things which you want to take back home to do it in our hospitals. And I noticed that technology is used here, and it's very much can prevent a lot of patient problems, patient falls and medication errors. So he was telling me, please write it down and just do whatever you can do over there in Saudi Arabia.
Thank you. Would you like to cover?
Yeah, I think I'm going to repeat the same thing which has been said now and this morning. There is something special about this place, has been said, and I'm proud and happy to be here. The experiences, and the type of education I received from this institution is great. The values and the institution is built on, and the tradition is there. You can feel it. You can live it. You can feel that there is love. There is unity around you. Everyone is, especially the faculty, is providing you with personalized experience in here. So I'm happy and thankful for every one of you for being here.
I feel the same thing. When I first came here, I mean, the faculty members and different faculty take turns to take us to dinner. They invited us, I mean, to their homes. So it's really like a part of the community, part of the family. I truly feel loved. So that's really, they showed from their actions and to carry the mission of Villanova. So I'm really, like they said, I'm proud of to be part of the Villanova, and also the Villanova nurses. Right now I'm trying to do the same thing for my students and for my Chinese community, the Asian community in Chinatown, in Philadelphia. So I did provide free seminars and for all different kinds of educations, like cardiovascular disease, osteoporosis preventions, and hypertension and diabetes, all that. So talking about like giving back what you have, like earlier the presenter said, I do feel like I gained really more than I gave, but I'm trying to do more to give back to the community. And also, you may know I do research with the Asian populations in Philadelphia and Chinese community. I'm thinking not just use them as my research subjects. I also need to contribute to that population, really compassionate and also committed, I mean, to improve the healthcare in the Asian population, because Dr. Lu said there's 100 people, 60% of them are Asians. So they are the majority. So I'm really committed for the lifelong commitment to improve healthcare in that Asian population in the United States, and also decrease the ethics and racial disparities in that population.
Lynn, do we have time for questions? Okay, I would love to invite at least one question from the audience. Anybody? Nobody? Okay, well, then I thank you for your attention. I thank you for
We have come to the end of what I think has been a very productive day, a day with a lot of food for thought, a day that, at least for me and I hope for you, has validated that I think we're on the right track here. There's still so much to be done in healthcare and nursing education. But I think this has been a good day also for reflection, to think about what else we need to do and how we need to do it. I want to thank most sincerely our two major speakers, Dr. Louis Hugo Francis Scuti
our friend from the north, from Alberta. I'm glad I met you in Oman, and I hope we meet again. He has just been a wonderful, wonderful guest and a wonderful speaker, and I think he's really opened our minds and helped us to think about healthcare in a whole different way. So I'd like you to please acknowledge him once more. And certainly Dr. Naima El-Gassir, who is certainly an energizer, a mover, a shaker, someone who is going to certainly, and already has, an impact on healthcare all over the world, not just because she's with WHO, but because of her commitment and her passion for what she does. And she's a wonderful role model for all of us in nursing. So thank you, Naima. Every single one of you, faculty, alumni, and students who served on this panel. For me, it was validating, it was informative. You know, I think I know what you're doing when you leave us and take your clinical courses abroad, but today it was as informative for me as it was for everyone else, and I thank you for being willing to share your experiences with everyone, and to also help ignite some of the excitement in students who may still have the opportunity to do the things that you have done. And most particularly, I want to thank the planning committee for this conference and this weekend. And of course, the weekend isn't over. We have our annual Mass tonight and Alumni Award ceremony. That is at 6 o'clock in the church, and a reception afterwards in Driscoll Hall. But I want to thank in particular Lynn Desolette, Anna Gustafson, Marianne Lieb, Ann McKenzie, Leslie Perry, Rose O'Driscoll, Marguerite Schlag, Nancy Hopko, even myself. We all did our bit. But I want to thank another group. Last night there was an event for our donors and friends and our board of consultants, and there were some faculty present who were presenters today, but the majority of faculty were not there. And Father Peter acknowledged the faculty who were there last night. If we are successful at Villanova, and I think we are, and we never, you know, my mantra has been here for all these years, we are never complacent. So we don't rest on our laurels, we keep moving ahead, trying to improve, regardless of how ambiguous the times may seem in higher education and nursing. But the people that make it happen, no matter what we plan on paper, no matter what the curriculum says in the catalog, are the faculty. Thank you. Please stand.